Today we will talk about what are the changes a woman breast undergoes during their pregnancy and breastfeeding. Many women come to us after breastfeeding, after their pregnancies are over, for mommy makeover procedure, which of course involve not only breast reshaping but also tummy reshaping. But today we'll talk about what are the changes in the breast shape which any woman would undergo once they become pregnant and have had kids and breastfeed them. So first changes is the breast increase in size. Because of all the hormones, the milk production, the breast increase in size. And once they have delivered the baby, delivered them and even breastfed them and stopped breastfeeding, the size reduced but did not reduce completely. So in the end, what they are left with is a big sized breast, which not only remains big but also sags a bit. So they end up having a bigger breast, which is also sagging. So this needs a breast reduction or a breast lift surgery. The second thing is they may end up reducing the size once the hormones settles down, but eventually the breast sags. So they may have a reasonable size breast, but it sags. So this is a normal size breast which is sagging. This is a big size breast which is sagging. Both need a breast lift surgery. If they want to reduce the size, that can also be done. In fact, if they want to increase the size, that can also be done at the same time. But the point that I'm trying to make, any sagging will end up need a lift surgery. The third thing which can have is they may lose the volume which they gain, but because of the good skin quality, some women do not sag. But because they lose volume, they end up being deflated. And what it looks like. So that is a deflated breast. This needs a different kind of surgery than this and this. So what you need to understand, there are different changes which happen in any woman's body, especially the breasts, during pregnancy and then breastfeeding. Depending upon what the changes they've had, a surgeon needs to identify them and plan the surgery depending upon what are the aesthetic goals of our patient. So depending upon whether they have huge breasts, they need a breast reduction. If they have breast sagging, they need a breast lift. If they have a deflation, then they need a volume correction or augmentation. If along with that, they want an upper pole fullness or a cleavage, and their breasts are falling apart and they want a nice cleavage, that can also be done. So this was my attempt to explain you what all things happen in any woman after the breastfeeding. If you have any more questions about these surgeries or any other cosmetic surgeries, please connect with us. Me and my team are always there to guide you honestly and scientifically. Thank you.